Good evening, everybody. Welcome to Healthy Minds, Supporting Children with Anxiety. My name is Han Grabowski. I am a school counselor at Howe Elementary School. My co-host is Matt Rizzuto, our school principal, and our speaker tonight is Sarah Hazlett, licensed clinical social worker and therapist, who is your main speaker for the evening. We are very lucky to be here tonight. In fact, there's two other members I want to thank in this audience. We have Amy Gorella and Lori Haller, whom without, none of us would be here tonight. Earlier this year, they approached us to say, hey, there's a Healthy Minds grant. Let's get together, collaborate, and see what we can do. So that grant has been approved, and because of that grant, we are all here in this room attending the session, and Amy's leadership has gotten us onto the program for this evening. So thank you so much. Thank you both. Sarah Hazlett is a therapist in Bridgeville. She has over 12 years working with families and children and teens. She's worked with community outreach programs and school buildings to support the mental health of all of our students. So please welcome Sarah Hazlett. Thank you.
Thank you, everybody. Thank you, Mrs. Grabowski. Good evening, everyone. I'm really excited to be here. A little bit nervous, but really excited to be here. Typically, I am not speaking to a room full of people, and usually in my practice, it's not me speaking for 30 minutes. It's an interactive dialogue. So I do welcome questions. If you guys have them, feel free to ask. I will just ask that you keep them more generalized, and then at the end, if you have more individualized questions for yourself or someone at home, then I will stick around and you can certainly ask me at the end. So tonight I will be on the slides. I reference anxiety, but please note that most of what I talk about also can apply to OCD, but I just didn't note that on tonight's slides. All right, so the game plan for tonight is I'm gonna teach you a little bit about how anxiety works, and then how anxiety presents in the family. And then the main point of tonight's presentation is to talk about a newer approach developed in the last 10 to 15 years called the SPACE program. And SPACE stands for Supportive Parenting for Anxious Childhood Emotions. And the two major components I'm going to be speaking about tonight is supportive language and parental accommodation. If you don't know what that means, that's okay. Hopefully by the end, you'll have a better understanding. So what is anxiety? I like this definition, that it's an overestimation of the problem and an underestimation of the resources you have to solve them. So if you think of a little one at home, they imagine that the problem in front of them is really, really big, and they don't have the skills to tackle that problem, right? So of course that induces a lot of anxiety. Anxiety is not just about feeling nervous. I'm sure many of you know somebody that has a diagnosed anxiety disorder, whether it's somebody in your friend group or family, or maybe it's one of your children at home. And we know that anxiety is really persistent and invasive. Anxiety within families, when families come to my practice, I start with saying that anxiety is like this bully or this cult leader that is dictating what you can do, what you can't do. It can cause a lot of chaos within families, right? So some of the emotional symptoms that you may see in your children are feeling overwhelmed, a sense of dread, irritability. Sometimes they are very demanding, or it can present as anger as well. Generally speaking, people who are diagnosed with an anxiety disorder also have physical symptoms related to that, such as increased heart rate, muscle tension, a lot of gastrointestinal problems. A lot of my referrals actually do come from local pediatricians, migraines, and then also sleep disruption. Anxiety impacts relationships. I think that is like one of the hidden myths about anxiety. It can obviously cause problems in peer relationships, participating in the classroom, as well as what I'm going to be talking about tonight, the parent-child relationship. So surprisingly, or maybe not, anxiety is the most common mental health condition in the US. About 1 in 3 children will be diagnosed with an anxiety disorder before they graduate high school. But the good news is that anxiety is a very treatable disorder. There's tons of research that shows that anxiety is not a chronic condition, meaning that it doesn't have to necessarily be a lifelong disorder. Does anybody have any questions so far? Okay, perfect. So if you have an anxious little one at home, you might be familiar with some of these behaviors. Anxiety in children can look like trouble falling asleep at night, or maybe bedtime routine can be long and drawn out, sometimes exhausting. There might be an unwillingness to try anything new, whether that's a new food or a new club or after school activity. Maybe the child will quickly enter a state of panic or get really, really upset if there's a change of routine or a surprise that happened in the middle of their day. Sometimes socially anxious kids have difficulty initiating conversation with their peers, raising their hand in class, placing an order at a restaurant. I have a lot of teens that really rely on like the Starbucks mobile app because they can't go in and order a drink. Anxiety can also take on as perfectionism, so they're overscheduled, they don't know how to turn off their mind, they just don't know how to cut corners or like when to say enough is enough. So like I said, anxiety is very treatable. And around the 1960s, CBT was developed, cognitive behavioral therapy. Essentially, that philosophy is we all have thoughts, those thoughts impact how we feel, and our feelings impact how we behave. So working with a therapist, the individual will then work to kind of challenge their anxious thought patterns in order to feel differently. Another popular treatment is exposure therapy. That's generally used for OCD, social anxiety, and also some phobias. Exposure therapy is when the client goes out into the world and kind of does mini experiments to test their anxious thoughts. But tonight we're going to focus on space. Like I mentioned, space was developed within the last 10 to 15 years by Dr. Ellie Leibovitz out of Yale School of Medicine's Child Study Center. SPACE stands for Supportive Parenting for Anxious Childhood Emotions. And what Dr. Leibovitz found in his practice and in his research is there tended to be a common theme when he was working with anxious families. He saw that the relationship between the child and the parent, there was a lot of parent accommodation happening, and that is why he developed SPACE. So what exactly is SPACE? It's really different from CBT and exposure therapy because unlike those two treatments where it's typically child-focused, SPACE is parent-focused, meaning the child never has to step foot into a therapist's office, which is really helpful if you have a teenager or a child that refuses to go to therapy, or maybe they're so anxious that it's even hard to get them to agree to go to therapy, or for some little ones, maybe CBT wouldn't be appropriate just because of their developmental level at that point. So in SPACE, the typical length of treatment is about 10 to 16 sessions. Obviously, that's going to vary depending on what the parent needs. The focus is on the only thing the parents can control, which is yourself and how you respond. So it's not about forcing your kid to do anything. It's not about bribery. It's not about sticker charts. It's only focusing on how you respond. I think that's my favorite feature about the SPACE approach because it's really just geared towards parents. So in the clinical trial that was published in 2019 about SPACE, it was found to be just as effective as CBT, which even surprised Dr. Leibovitz. He was not expecting those results. And then an added bonus with SPACE is that there was shown to be an improvement between the parent and the child. Excuse me. All right, so SPACE is also effective for the treatment of OCD, all types of anxiety, and something called failure to launch, which is when a young adult doesn't leave the nest. They stay at home because of an over-reliance or an over-dependence on their parent. And then also it's been effective for the treatment of ARFID. ARFID is an eating disorder that is essentially picky eating to the extreme, that a child refuses to eat food and it causes nutritional deficiencies and also severe weight loss. So there's 4 main components of SPACE. When a parent agrees to work with a therapist with SPACE, the parent will do a lot of education about how anxiety works, how it impacts the brain, how it impacts the body, because SPACE believes that the parents need to know exactly what the child is feeling, right? And then also the therapist will help the parents create very healthy boundaries. Typically in anxious families, there's a lot of enmeshment or unclear boundaries because the children rely so heavily on the parent, and there's no separation between anxious child and parents, and that's so draining for parents. So establishment of healthy boundaries is really important. Tonight I'm going to focus on the use of supportive language and then also reducing parental accommodation. I think up next is a very short clip. Oh, do you have a question? Yes.
When you're talking about anxious families versus an anxious child, is that like, are you talking about them concurrently? Like you have a family that is anxious in general, or like a child that is battling with anxiety is just causing a lot of anxiousness in the house, or both?
Yes, well, I guess both to answer your question, but also I think in the SPACE approach, there definitely, Dr. Leibovitz believes that an anxious child just it impacts the entire family system, right? So anxiety doesn't live in just a cute little box, right? It impacts all of the relationships and the routine and everything within the family. Yeah, thanks for that question. Anybody else? Okay, so the video I'm about to show you is about a family that participated in SPACE because their son was having a terrible time falling asleep independently at night, and it caused a very, very long bedtime routine to happen, and they found SPACE to be very helpful.
Bedtime for some families can become a struggle, but when the goodnight routine for Nicole Murphy's son began to stretch for up to 3 hours, she knew she needed help with his separation anxiety.
His little mind was always racing, nonstop, so it was kind of hard for him to shut that off, I think.
Ellie Leibovitz and his colleagues at the Yale Child Study Center developed a method of training parents to support anxious children. It's called SPACE, or Supportive Parenting for Anxious Childhood Emotions. Parents go through training to help their child face anxiety. Leibovitz says the first step is to show support and not downplay what their child is feeling.
I get it. This is really hard, but I know you can handle it.
Leibovitz says parents also learn to help their child by not accommodating them. For example, a parent who would limit visitors for a child who gets anxious around strangers or speaks for a child who gets nervous speaking learns not to take those steps. In a study of 124 kids and their parents, the Yale researchers examined whether the SPACE intervention was effective in treating children's anxiety.
Even though the children never met directly with the therapist and all the work was done through the parents, we found that SPACE was just as effective as CBT in treating childhood anxiety disorders.
The Murphys used the techniques learned through SPACE to coach their son through bedtime. Within a few weeks, he was falling asleep in 30 minutes.
For us, it was like life-changing, honestly.
I'm Nancy Alvarez reporting.
So one of the core principles that Dr. Leibovitz believes in is that anxiety is an interpersonal event, which means that in order for the anxiety, there's going to be times where children experience feelings of anxiety, right, or worry. But in order to be an anxiety disorder, it has to be ongoing. And so he believes in order for it to be an ongoing process, there needs to be 2 components. First, you have a distressed child, and then you have a parent or a caregiver responding to that distressed child. And he states it's natural and normal for children, when they feel anxious, scared, worried, or threatened, to look to their parents to feel safe and cared for and to seek reassurance from their parents so they feel better. It's also natural and normal for parents to want to do these things. However, that can lead to parents getting really sucked into and entangled in their child's anxiety. So what he's saying is it's totally natural, and parents are hardwired to respond to their distressed child. If they didn't do that, infants wouldn't make it to childhood, right? So it's totally normal and natural, and it's not your fault. What I do like about the SPACE program, and its main focus is taking away the blame that a lot of parents feel for their anxious child, because it's not your fault. And so many parents come to me at my practice feeling just so lost and so guilty because their child can't handle life and they don't know what else to do. So I like SPACE because it takes the blame away from the parents and say, listen, what you're doing, you're hardwired to actually do. But the tricky thing is it gets really murky for parents to know, when do I step in and respond to my distressed child, and when do I step back and say, okay, you're gonna feel distressed, you got this, I got this, and then let's try to tackle the problem. Does that make sense? And so think of this interpersonal event as kind of this dance or this relationship that is ongoing. And so the goal of SPACE is to interrupt that dance from happening. Does anybody want to take a guess at what age a mama bear chases her cubs out of the den and says, you're on your own, kids? Does anyone want to take a guess? 3 months? No. A year. It's actually 17 months, right? Which still seems really young. I'm really happy my mom did not chase me out of the house at 17 months. I probably wouldn't be standing here today. So infants are with their caregivers for a lot longer than many other mammals or animals, actually, right? So we have 18 years to develop that interpersonal event. So there's so many more opportunities for this anxiety cycle to really develop. And if it starts really young, then the patterns are so ingrained that it makes it so hard to change. So SPACE is certainly not an easy thing. I think that video that I showed you was probably unfair because the parents were like, yeah, and then now he's sleeping in 30 minutes. But there was a lot of work that went behind those results on the parents' end. All right, next we're going to talk about supportive responses. So when a child signals that they are in distress in SPACE, after parents learn about how anxiety works, after they create boundaries between anxious child and parent, then the therapist will work with the parents to look at this continuum of where do you guys fall on how you respond to your anxious child. And one end of the spectrum is a protective response. The other end of the spectrum is a dismissive or a demanding response. And what SPACE tries to do is kind of meet in the middle to use a more supportive response. A protective response may sound like, here, let me do that for you. This is too hard for you. This is too much for you to handle. I'm not sure if you're ready to do that yet. And a protective belief system that a parent or caregiver may have is that it's your job to ensure that your child has an easy and comfortable life, which makes sense. Again, this is coming from a really good place, that your child should feel okay and happy all of the time, that your child can't handle it, and that it's your job to remove any and all obstacles. This, again, is coming from a really, really good place, but you can imagine that if this is kind of the interpersonal event, the language and the pattern that is happening, what the child then eventually learns is if my mom or if my dad doesn't believe that I can do it, then I probably can't do it. Of course, that is the nonverbal, unintentional message. But if mom is coming into my room every night because I say that I can't sleep without her, every time she comes in and sleeps with me, she's reinforcing that idea that I can't do it by myself. Is that pretty clear? Okay. So at the other end of the spectrum, and again, this is a spectrum, so it's not like 3, 1, 2, and 3. You can fall anywhere on that continuum. On the other end is a dismissive or a demanding response. And what that might sound like is, what's the big deal? It's not that scary. Your brother did it, why can't you? I don't understand why you're so afraid. And a belief system that a dismissive approach might be is they're only doing this to get attention, you just need to grow up, you're way too old to be acting this way. So from this approach, the nonverbal, unintentional message that a child gets is, wait, everyone's saying that I'm not allowed to feel scared, but I'm feeling really scared. So what is wrong with me? Like my dad, my mom, everyone's saying that I shouldn't be feeling this way, but I absolutely do. Because remember, anxiety has a lot of physical symptom components. So what we aim to do in space is to use a supportive response. And supportive responses have two parts. First part being acceptance. That may sound like, this is really, really scary for you, isn't it? I'm sure you're really worried about tomorrow's test. And then confidence. So acceptance is validating the child's emotional experience, right? So you're saying, yes, you're allowed to feel nervous because in your little mind, this feels really hard for you. And then the second piece is confidence. And this is where you get to be your child's cheerleader. This is instilling that you believe that they can do it or that they can attempt to do it, right? And it may not be 100% successful, but they're going to go in and they're going to try. And so you need both parts in order for a response to be supportive. So some examples of a supportive response. I know this is hard for you, and I know that you can do it. You look really uncomfortable right now, or you feel really uncomfortable, but you're going to learn how to manage it. You got this. All week as I was prepping for tonight's presentation, I was practicing with some colleagues, and they kept saying, oh, you got this, Sarah. I'm like, did you guys not listen to my presentation? You're not using supportive responses. You need both parts. Any questions about supportive responses? Okay. So let me just go back one moment. If you're more on the protective side or more on the dismissive side, you're not just going to change overnight, right? So we have to give ourselves grace when we're learning how to change how we respond to things, because some of these responses are very automatic. So again, this is not easy, but it's definitely worth it. I would say parent accommodation is probably like the meat and potatoes of space. It's the major part. Accommodation is any action a parent does to help a child avoid or alleviate distress related to feeling anxious. So you can imagine that there's a whole host of accommodations out there. And just know that everyone accommodates. All parents accommodate. I accommodate kids in my office. If they're like, Sarah, I don't really want to talk about that right now. I'm like, okay, we don't have to talk about it right now, but we will eventually, but maybe not right now. And that's an example of an accommodation, right? So it's not necessarily a bad thing if we're accommodating. But I think the key is just being more mindful about it and knowing when is it okay to accommodate and when is it not okay to accommodate, right? So I work with a lot of schools. We have accommodations in place at schools. That's not a bad thing, but the goal is to eventually reduce the accommodation so the child and student learns how to do these things. They don't want to be graduating high school with 50 accommodations, because that means that there's no skills that are being taught, right? Yes.
When thinking about this from a parent perspective, and you're going back to talking about exposure therapy earlier on as well, any advice you have on maybe it's good to take small steps towards pushing to like a place so uncomfortable, and when is it just throw them in the water, like try to see if they can swim?
Yeah, so I don't recommend throwing them in the deep end. Usually doesn't. Yes, yeah. And I wish I had a really black and white answer for you. So I think that, yes, in exposure, we do something called a hierarchy. So if I'm afraid of spiders, I'm not going to the zoo and petting the tarantula, right? So I might start by going to the library and reading Charlotte's Web or watching YouTube videos about spiders. And so gradually you're gonna kind of work your way up, and knowing that the goal may never be for me to have a pet spider, but just for me to be able to walk into a room, and if there's a spider, I'm not freaking out. So with space and some of those accommodations, the therapist is gonna work with you so that you're not pulling the hardest accommodation. You're gonna start really small, so that parents then gain confidence and it feels manageable and easy, right? Does that make sense and answer your question? Okay. Anybody else have any questions? So Dr. Leibovitz says sometimes the best way to help in the long term is to not help in the immediate term. And when I first read this during my training, I felt really weird inside. Yes?
You talked about the supportive has two major parts. One of the parts is the confidence.
Mm-hmm.
Do you mean the confidence that your kids will recover eventually with your help, or do you mean that this is confidence that I will do this right?
Oh, okay. So you're not necessarily that they're going to do it right, just that you believe that they can start it, or that you believe that they can attempt it. Not that they're going to go in and, let's say that you're using a supportive statement when your teenager goes and applies for a job. I know that you're feeling really nervous, but I know that you can do this. That doesn't mean that they're going to go in and land the job, right? That's not the expectation. But I know that you can go in and you can grab an application, or you can ask for the manager of the store.
So the confidence is really on the kids to be able to handle themselves.
Mm-hmm.
Not necessarily that I'm doing the right thing for you.
Right. Mm-hmm. But I think you're also implying that because they're going out on their own and they're building those independent skills, that is kind of what the goal should be, right? Does that answer your question? Okay, that's a good one though, thanks. So this quote, it made me feel really weird inside, because as a helper, I knew that if I was not intervening in the short term, that someone was going to be in distress for even a tiny moment. And as a helper and as a parent, that should make you feel kind of weird inside. But knowing that in the long term, this is really the best way for the child to learn these skills. So these are some examples of accommodation. Speaking for your socially anxious child when ordering at a restaurant, providing constant reassurance or asking the same question over and over and over again to ensure that they know exactly what will happen. Canceling plans with a partner or a friend because your child is afraid to be away from you, or nightly co-sleeping because they feel like they can't sleep by themselves. I had one family, I know Mount Lebanon doesn't do busing, but they were in a different district, and every morning the little girl would throw up, and every morning she would not eat breakfast, and every morning mom would drive her to school. And now, since working through space, she still sometimes throws up every morning, but mom is not responding as this is not a big deal. Okay, you're throwing up, let's wipe your face, brush your teeth, and we're going to school. And she finally got on the school bus, and last week we did a session at Dunkin' Donuts, and she ordered munchkins all by herself. So, just to see her confidence and mom's willingness to not rescue her daughter when she's feeling a little bit uneasy, it was just so awesome to see. Yes?
Have you ever had parents complain that they couldn't convince the kids to take a vacation?
To take a vacation? Well,
or follow the plan they made.
Yeah, that makes sense because, it's out of their typical routine, or it's new and it's uncertain. So that's going to spark some anxiety with some kids. Yeah, absolutely.
Is that the time you should have stick with your gun, say you have to follow, or you need to manage this through?
Yeah. Because if not, then you're definitely providing an accommodation, because the whole family is now not going on vacation because of someone else's anxiety. Yeah, that's an example. So the accommodation cycle kind of looks like this. First, we start with a distressed child. Let's imagine that we are at a restaurant and the plan is for the child to order their hamburger and french fries. Server comes over, everybody orders, and then the child puts their menu on their face and slides underneath the table and won't say a word, right? So mom and dad are probably feeling a little bit uncomfortable, maybe embarrassed, maybe frustrated because this was the plan and you're not ordering. So immediately a parent will give the server the hamburger and french fries order. What just happened? Was it a family accommodation? So immediately short-term relief happens, right? The child is relieved that, oh, thank goodness they rescued me and I'm getting my burger and fries. And also parents benefit from family accommodation too. Don't forget that, because now you're no longer feeling embarrassed and you know that your son's gonna eat dinner tonight. However, over time, the anxiety cycle gets worse and there's this continued dependence on parents are gonna continue to order for me, and the child never develops a skill on how to tolerate feeling uncomfortable. So accommodations over time lead to both parent and child believing that the only way for a child to function is through accommodation. And I think that nobody wants that for their child, right? No parent wants to have a child that is so reliant on them to get through life. Also, repeated accommodation leads to higher levels of dependence and overall just less skill building and feeling less confident, capable, resilient, independent, right, from the child. So working with a therapist, the parents will be asked to make a list of all the accommodations that they're doing at home. And again, it could be a very, very long list. And then they're going to be asked to track their frequency. So maybe take some tally marks of how often you're doing accommodations. And believe me, accommodations can happen, 50, 60 times a day, depending on how anxious the kiddo is. Then the parent and therapist will meet and choose a target accommodation. And this is something that's going to happen in high frequency, but is not going to feel like you mentioned at the top of the list, right? We're going to start really, really small. And then they're going to develop a plan to reduce the accommodation. And then the parents will then inform the child, hey, mom's not going to order at the restaurant for you anymore. And then we're going to implement the plan. This is like scratching the surface of reducing accommodation. There's a lot more involved. There's a lot more support involved, but this just gives you kind of an idea of where that would go. So what you can do tonight or tomorrow after leaving tonight's session is you can start using supportive statements. Remember, supportive statements include both confidence and acceptance. And then be more aware of how you respond to your child's anxiety or how your partner is responding to your child's anxiety. I think just being more mindful about how, again, that cycle, that interpersonal event that Dr. Leibovitz said. So just being more aware of how you're responding, I think, is a great starting point. Think about if you're accommodating, how you're accommodating, how frequently is it happening. And the most important part, give yourself grace and compassion and speak kindly to yourself, because parenting is really, really hard. And I think many parents don't remind themselves of that. This is hard, hard work. So if you're interested in learning more about space, there are 7 local providers in the Western PA area that have been space trained. I was trained in 2021. You can find the list of space providers on the space website. It's spacenet.com, I believe. There's also OCD Spectrum practice in Bridgeville. They host workshops probably every 2 to 3 months for parents. They're virtual. The next one is starting in March, and they have information on their website. And then I hope to be starting a group this spring. I have no idea logistics yet, but I have a sign-up sheet in the back. If you're interested, you can give me your email and I'll shoot you an email when I have some ideas of when that will be starting. If you're more into like independent learning, I would definitely recommend Dr. Leibovitz's book, Breaking Free of Child Anxiety and OCD. It is written for parents. It goes through the entire SPACE program, so you can basically teach yourself SPACE. There's no clinical jargon. It's really easy to read. Also on the website, spacenet.com, his podcasts, interviews, YouTube videos, clinical trials are all published on his website. And that is it. Thank you guys so much for being kind and coming tonight. I am so happy that this is great attendance, so I'm so excited to see this.
Thank you, Sarah.
Yeah, no problem.
For the wonderful presentation. Myself, as a parent of 4 young kiddos at home, I certainly got a lot of takeaways and have found myself often on both sides of the spectrum there. So thank you. I appreciate everyone coming out tonight, braving the cold weather and coming here. You know, it's important work, and as parents, it is, as you know, very challenging at times. So I appreciate your attendance tonight. I hope everyone has a nice evening. And again, Sarah's information is back in the back table and a sign-up sheet if you are interested in connecting with her afterwards. So thank you.
Thank you.